Lisa Giuliano, and I'm the Superintendent for the Butler County Board of Developmental Disabilities. I want to thank all of you and your staff members for what you're doing every day to support people with developmental disabilities during this healthcare crisis caused by the coronavirus. I am grateful for your dedication daily to maintain the health and safety of the people you serve who have medical conditions that place them at high risk if they become ill with this virus. I know that as providers of direct service, there are increased risks for your employees who may be exposed to the virus as they provide care and support to people. Our board has secured equipment and supplies to help minimize risk for exposure, and many of you have requested and received these items. Please continue to let us know when you are in need of supplies, and we will work to fill your requests. As we continue to move forward, knowing the coronavirus will be with us for some time, we can help if you are putting guidelines in place to reduce risk for your employees and the people you serve. You can also reach out to our nurses with questions about symptoms and receive nursing advice. We are fortunate to have such remarkable providers during this most challenging time in our nation's history. Thank you so much for your service to people with developmental disabilities throughout our county.
Provider Relations Coordinator for the Butler County Board of Developmental Disabilities, and I'm going to give a general provider update on some things that have been happening during the COVID-19 crisis. As always, you can reach out to me via email, or my phone number is listed there on the screen. We will also make this PowerPoint available in our weekly provider update so that you will have all the links. Just to review a few of the supports that Butler County has put in place during the pandemic, all of our departments are working and available, including support coordinators and investigative agents and all of our resource support people such as nurses and HR. If you need to reach us after hours, you can call the on-call number 513-867-5913. We've been offering background checks to assist those providers who don't have in-house background checks or independent providers. You can contact Dawn Hamlin to schedule that. Her email address and phone number is listed. We also are offering assistance with CPR and first aid questions, specifically assistance for independent providers to get an extension on the CPR and first aid requirements or to schedule skills checks after the pandemic. You can do that through Michelle Truitt, our nurse. Her information is also on the screen. We also have been offering some limited PPE and other supplies such as cleaning supplies and hand sanitizer. If you have a need for any of those, please contact me at my email or phone number. A few reminders about incident reporting. There's been no changes in the UI and MUI reporting requirements. The timelines are the same, and you do need to reach out if you have UIs or suspected MUIs, and you would contact Rebecca Lyons, the investigative agent. You can email her at mui@butlerdd.org or call her at 867-5992. You can always use our after hours on call if it's after 5 o'clock. For specific COVID-19 reporting, if you have someone who has a suspected case or has been tested, you must notify the support coordinator as soon as possible. And DODD has provided us some additional guidance that they're going to have questions when you call to report this. So you need to be prepared to answer the following questions. What precautions have been taken to protect the person and others impacted? The person's living situation, the number of people living in the home, the name of the hospital where they were admitted, any symptoms, and their known history of respiratory issues. Something different that is happening during the COVID-19 crisis is, regardless of the chronic condition being in the ISP, all hospital admissions will be filed as an MUI if the person is tested for COVID-19. And our Office of Incident Review will need the results of that testing when it's available. Another word about supporting individuals through illness. We sent out last Friday the standards of care guidance that was released through DODD. Because we had been receiving information that DSPs and other folks were not allowed to assist individuals when they are going to the emergency room or the hospital or a doctor's appointment. So we just wanted to remind all providers that part of that standards of care says that a family member or caregiver should be allowed bedside access for patients who normally require assistance with activities of daily living. If this is not possible or it poses a significant barrier to infection control, alternate arrangements should be made to meet the patient's unique needs. A caregiver's active role is essential to the patient's health outcomes. So we want you as providers, both independent and agencies, to be able to advocate for the individuals that you support using that standard of care guidance. And you can find that link here in this presentation as well as in our provider newsletter. There has been a lot of rule relaxation during this time period, and this is just a reminder of a few of those. Most importantly, what I'd like to remind you of is that DODD guidance is sent out regularly, minimally at least every week, but oftentimes multiple times a week, related to various aspects of providing service during the pandemic. The link here to see all that guidance is on the screen. Also, you can sign up to receive those automatically. If you aren't doing that, I would highly encourage you to be receiving those guidance directly from DODD and reading those as they come in. But a few of the reminders of things that have been, rules that have been relaxed that probably would be important for providers. There has been a lot of relaxation about onboarding requirements for new DSPs, including training and the timelines for the actual BCI check. There's also been some relaxation of the CPR and first aid skills check requirements and extending CPR and first aid certification dates. There's been some relaxation that allows parents to provide services to their minor children in the event that they are the only caregiver available. There's been some adjustments to level 1 budgets, allowing for the full use of the budget if the individual needs caregiving or assistance outside of what they would normally receive. As well, all compliance reviews have been put on hold for the time being. So if you had a scheduled compliance review anytime between March and all the way through June at this point, it looks like you will not be receiving that as scheduled. Those will be rescheduled when that work starts back up again. Lastly, I'd like to talk a little bit about adult day services, both now and in the future. This seems to be where a lot of the activity is related to questions and changes and people wanting to get back into their normal adult day vocational habilitation programs and facilities. So last Friday, two Fridays ago, May 8th, DODD released some new guidance regarding adult day, vocab, and NMT, and you can find that guidance on the DODD page. The link is here. There were several things in that guidance to assist providers in a phase-in approach to reopening, and there was an additional option added called the STEP option. If you have not reviewed that, you probably will want to take a look at that, but this option allows you to continue to serve people in their homes or in safe community settings in groups of 4 or less. And one of the real benefits of this is it actually is paid at the C acuity rate, which is the highest rate. And there's new billing codes for that. And you will have to receive authorization to provide this service. So if you're interested in the STEP option and have questions, you can reach out to me, but you'll want to start that conversation with the team and the support coordinator involved. As well, you continue to have the option of on behalf of adult day and vocab, as well as virtual, although the STEP option includes the virtual services. So most people will be using that now instead of virtual. On behalf of would be doing things for the person without them present, things like grocery shopping, picking up medications, or possibly preparing packets of things for them to do at home related to adult day or vocational habilitation. If you run an adult day or vocab program and are planning a return to some facility-based services, there's a twofold process in place. The first, and these are parallel processes, so when I say first, it doesn't mean that one has to happen before the other, but they would be happening at the same time. The people who are being supported and their teams, including their SSA, families, guardians, other providers, will come together and have a discussion about the risks and benefits of the person, benefits to the person returning to facility-based supports, and what transportation they will use. There's a risk-benefit discussion guide that's available for you to look at that the team is going to ask the questions and have a conversation. And then once that discussion has happened, there'll be a team acknowledgement form with the decision of whether or not the individual will return. To get this process started, you're going to contact the support coordinator and be ready to have some of those conversations about the benefits to the person and what might be some concerns. Additionally, each provider of facility-based services will need to complete a provider assurance form that's going to be submitted both to DODD and to Butler County DD, and that includes all the necessary safety precautions that they'll need to have in place to open. You can send that assurance form to me, and if you have questions about some of the specifics on that form, you can reach out to me or DODD. As a reminder, facility-based services are only for groups of 10 or less, including staff at this time. There's no announced date or plan for a full return to facility-based services. That's the majority of what I needed to talk with you about today. I hope you're all doing well, and feel free to contact me in whatever way you're comfortable with, phone calls or emails, and I will get back to you as soon as possible if you have questions about provider-related concerns. Stay well, and I hope to see you soon. Thanks.
Hi, my name is Darren Collins. I'm one of the Quality Assurance Coordinators with Butler County Board of Developmental Disabilities. And next, I'm going to walk you through our new General Satisfaction Survey. We have a new General Agency Satisfaction Survey, which is live now. Now, in recent times, for providers, there hasn't been a survey just targeted to get your feedback. So we definitely wanted to make that change. So when we redid our satisfaction survey, there is a portion specifically designed for your feedback. For this survey, there is one entry point for everybody, be it provider, individual, family, guardian, etc. We want this to be easy to find, easy to complete, and then we know time is very valuable. So the aim is that you complete this survey within 5 minutes. So where to find the survey? It's on our website. Right there on the slide, there's a red arrow. There is a link for you to click. As a sidebar, our website is currently getting designed. It's getting improved for a new one. So whatever that new one will look like, there will be a link to the survey on the first front page, the home page of the website. At the bottom of any board staff members' email, underneath their signature, there will also be a link. Now, this is also an ongoing process. Multiple staff members have already made this change, but in the upcoming weeks, every staff member will have this link underneath their email. If you're in one of our buildings, there will be posters on the wall. Again, to be candid, during the time of COVID-19, those posters aren't up yet. So hopefully when we get back to some kind of normality, those posters will be up. There'll be postcards distributed in waiting rooms and meeting rooms, which will have the link and information on there too. Leanne in her provider emails will be sending out information for this survey. And then also, if you have any clients, they'll be given these postcards by their support coordinator as well. And again, with the one link in, you can use this to fill out a survey as well. There'll be information on there. Here's an example of one of the postcards. If you actually have a smartphone handy right now, if you could open up your camera, you can lift it up to your screen and hold it over this QR code, and then a link should pop up on the top of your phone, top of the screen right there, and you can touch that and it'll send you to the satisfaction survey. Or if you want to go the more traditional route, you can copy and drop in the your web browser after the word visit, the bit.ly/ButlerDD survey, and that will take you there. As an alternative, if for some reason you don't want to complete the survey, you can just send us feedback in an email to the email address feedback@butlerdd.org. So our purpose and outcomes for this, we want to gauge overall satisfaction with Butler County Board of Developmental Disabilities. We'd also like to know what we're doing well, but also what we can improve on. We want to be able to identify some new opportunities, some things that we might not have considered. There are a number of open text boxes in these surveys, so you can share your ideas and information with us. Also new for us, departments have gathered their own satisfaction surveys before. And going forward, the quality assurance department will be gathering all of that information. So there'll be one gathering point. So we can also have universal questions asked across all departments. And this will also allow us to track any trends and patterns. And with this new survey, we're embracing technology. The majority of our surveys were done on paper. Some were electronic, but the majority were paper. And one thing from moving now to completely electronic, it will actually allow us to save and track that data over time, which would be great for our analysis. So right now I'm going to exit out of this PowerPoint and go through an example survey with you. So I'm on the provider news page right now on the website. I'm going to hit the home button, or you can hit the logo. It's going to send me there. All right, so this is the front page, and right here is the survey link. So we'll take this one together. Thank you for taking the time to complete this survey. We value your feedback. The survey will likely take you less than 5 minutes to complete. If it does take a little bit longer, it's maybe because you're writing a lot in the text boxes. Please pick the most appropriate selection below to start your survey. Once you have selected your answer, click on the arrow in the bottom right there to move to your next question. So you can only make one selection. We're going to go through the provider one. Let's start with a couple of the general questions for everybody. First is, how satisfied are you with Butler County Board of Developmental Disabilities? You'll make your selection and then you'll move on. The next one, again, asked to every department, is about timely communication. So let's make that selection and then we'll move on. Now these questions are specifically for the provider portion of this survey. So we'd like you to select which departments you've had experiences with whilst working with us. So the majority of the time, support coordination, you're going to be absolutely working with them. I can only see maybe if you're a brand new provider and you've gone through certification but you don't have any clients yet, you might not have experienced that department yet. Community services, they're the community connection folks. Have a lot of resources, the community events, the newsletters around activities. And then provider relations, that's typically Leanne, and some of the folks will help her too. And then, getting certifications, any questions, things like that. The MUI, Office of Incident Review. Then there's the administrative office. That's typically the people at the Janet Clemens Center, superintendent, any people you might come in contact with, booking meeting spaces over there for your trainings. That would be the administrative office. And then there's the Medicaid business office. So typically with billing and things, you would start out with the support coordinator, but let's say they connect you with a rate specialist. That's their office that they're going to be, you'll be interacting with. So let's say today we just rate, support coordination and MUI, and we move on. So each department, so you've been asked, overall with Butler County as an entire agency, how satisfied with you are and about timely communication. Now we want to know specifically the departments. You're going to be rating those departments. So overall, what is it? Overall responsiveness, and then also courtesy, customer service. And then there's going to be an open text box. What is something the support coordination department can do to improve your experience with them? So any suggestions, any feedback will be very welcome. And then it's going to ask you to move on to the next department, Office of Incident Review. So the same thing, you can select, go on. And then again, what is something you can improve on? I'm just going to make a little note for myself, test there. So is there anything else you would like us to know? If you select no, the survey would end. Yes, then you have an open text box. So this is really, you're free to write whatever feedback you want to give us at this point about any department, any staff member, any services, anything you want really. And then go ahead and finish. And that's the survey. I'm going to jump back over here just to wrap it up. So these surveys are anonymous. It's an anonymous link, so we don't know who actually completes these surveys. The only way we would know who completes them is if you were to write in your name, your information within one of the open text boxes. And then this survey can be taken year-round. There might be drives every once in a while, maybe quarterly, encouraging you to give feedback, but you can do it every week if you wanted to. You can do it as many times as you want to, and that goes for anybody. Family members, individuals, guardians, advocates, anybody who wants to complete the survey can complete it as many times as they want. And then as a reminder, alternatively, if you don't want to do the survey route, you can always email us at feedback@butlerdd.org. All right, I really appreciate your time and everything that you do. Thank you so much.